Welcome to this week's health and care update on the coronavirus in Devon. While cases here in Devon have been falling over recent weeks, that rate of decline now has started to slow down slightly. I'd like to hand you over now to Simon Chant, who'll be able to give you more information about the data in Devon.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 25th of February. We start with the national picture. Cases continue to fall nationally, but are still above levels seen in summer and early autumn. The number of tests and testing capacity remains high and deaths continue to fall. Now for the local picture. In Devon, for the latest available week, there were 290 COVID-19 cases and 10 deaths, with rates of both below the national average. Case rates are slightly higher in Mid-Devon and Exeter. Cases of COVID-19 are continuing to fall, although the rate of decrease has slowed. Case rates are currently highest for those aged 20 to 39, but have fallen over recent weeks in all age groups. The data in this summary is drawn from Devon's COVID-19 dashboard and a national coronavirus tracker, where the latest available information can be found.
Thanks, Simon. While it was good to see this week the publication of the government's roadmap, which does set out a set of dates for restrictions to be eased, it's really important that we remember these dates are the no earlier than dates. And each step down will obviously have to look at the science and the data and information, and those dates may well be pushed back if the science tells us the best thing to do is to delay those step downs. So at this stage, the most important thing to do is to continue to follow the national lockdown restrictions, stay at home, only go out if it's absolutely necessary, and follow those public health measures. Remember, keep your social distance, wear your face coverings when indoors and in public places, and wash your hands regularly. Now I'd like to hand over to Dr. Paul Johnson from Devon CCG.
The number of people in hospital with coronavirus has continued to decrease this week, which is really good news. On Monday, the Prime Minister set out the government's roadmap for cautiously easing lockdown restrictions in England. The roadmap explains the 4 tests for easing restrictions, and before we move to the next step, the government will continue to examine the data to assess the impact of previous changes. The 4 tests are the vaccine deployment programme continuing successfully, evidence showing that vaccines are sufficiently effective in reducing hospitalisations and deaths in those vaccinated, infection rates not causing a surge in hospitalisations which would put unsustainable pressure on the NHS, and the assessment of the risks not being changed by any new variants of concern. The government have said the 4 tests are currently being met, so the first step will proceed from the 8th of March. The success of the vaccination programme and the efforts from people to follow the government guidance around testing, social distancing and isolation when needed has meant this relaxation can start to happen. This is really good news. In order for these steps to continue to go ahead, it's really important that we all continue to follow the national guidance that got us to this point and get the vaccination when it is offered to us. Thanks to the hard work of the healthcare staff, the volunteers and the charities across the county, the vaccination programme continues to be vaccinating Devon's most vulnerable people. This includes over 95% of those aged 70 and over. If you are aged 70 or over, or on the shielded patient list, or a frontline health and social care worker, and you haven't had your vaccine, it's not too late to come forward. If that's you, you can book an appointment by using the national booking system, online, where you can pick a time and location that suits you, or by calling 119 between 7 in the morning and 11 at night, 7 days a week. If you're unable to attend a large vaccination site or pharmacy site through this national booking system and are over 70 or shielding or a health or social care worker, then please contact your GP surgery. You don't need to know your NHS number or to have received a letter to book your vaccine. Vaccination of the next priority group 5, people aged over 65, continues. This group can use the national booking system or wait to be contacted by their GP. GP practices are also vaccinating people in group 6, those who are clinically vulnerable. This is a big group of people, and the GP practices will be contacting their patients when it's their turn. So our message to you is, vaccines are the way out of this pandemic. They're the best way to protect you and your family from coronavirus and will save thousands of lives. As we start to see the lockdown restrictions easing, it's important now more than ever for everyone to play their part. And you can do this by staying at home and by taking the government guidance seriously. When you get your call from the NHS for your vaccine, please take it up. And remember, even with the vaccine, you may still be at risk to others if you are exposed. So it is crucial you stay at home wherever possible. And remember, hands, face and space. And use the NHS in the best way by thinking 111 first, or choosing the right service for your needs, including self-care or your local pharmacy or the local minor injury services or your GP.